Well, welcome everybody to the ICMDA webinar series. Today is the 14th in our series on COVID. I'm Dr. Peter Saunders, CEO of ICMDA, which is a network of over 80 national associations of doctors and dentists throughout the world. We're privileged today to have Professor Andrew Tomkins with us to speak about the role of church-based and faith-based public health programs in the prevention and care of COVID-19. So it's my pleasure now to introduce Professor Andrew Tomkins. I've had the privilege of knowing Andrew for many, many years. After his postgraduate training in pediatrics, Andrew worked in a new medical school in northern Nigeria, establishing a new management regime and collaborative research on the interaction of infection and nutrition in children. And then after research training in nutrition at the London School of Hygiene and Tropical Medicine, he worked in the MRC units in Nigeria and in the Gambia. And subsequently, his research team established a range of applied research and training projects in resource-poor countries based at the Centre for International Child Health, now called the Institute for Global Health at UCL, University College London. Andrew has assisted UNICEF, WHO, the World Bank, and also national governments in the development of their child health and nutrition programs. And he worked with Tearfund UK and overseas partners to develop church-based programs for prevention, treatment, and care of disease. He's now technically retired, if that's possible for Andrew, but he does not know how to do retirement, and so presently has his hands very pleasantly full supporting programs in northern Nigeria, Ethiopia, South Sudan, and Zambia. So it's my pleasure to introduce Andrew Tomkins with us today. And I'll hand over to you, Andrew, if you'd like to share your screen and proceed with your talk, and then we'll see you for the Q&A in 30 minutes. Thank you.
Well, Peter and people who are listening to this webinar, it's just such a privilege and a pleasure to be working with Peter and the great team of people that he works with. I've been a great admirer for the work of ICMDA, and this particular link of webinars around COVID has just been so helpful to many people in many countries. I'm basically a public health physician. And most of my experience has been in Africa, where I've lived or worked for quite a number of years. And now we are facing something that I've never faced before, nobody's faced before. And if you want to know a little bit more about how COVID is affecting your areas, I would say there are two websites that are particularly useful. The first is the World Health Organization dashboard, and you can look there, it's regularly updated. And the second is the Johns Hopkins Coronavirus Resource Center. And that is regularly updated. There's lots of extra material, including articles, research articles, policy articles. And I would definitely recommend you to access those if you'd be wanting to know what's going on in your country or what's going on in a country that you're linked with. One of the real challenges at the moment is that there are a massive number of deaths due to coronavirus. I basically living in London and in the UK, where we have one of the highest mortalities in the world. But there's a second aspect of COVID, and that is basically the issue of deaths due to lockdown. And so some of the seminars are going to be talking about COVID itself and its impact on mortality and illness, how to manage that. And secondly, we're going to be talking about lockdown. I have the privilege of working with healthcare workers in a number of African countries over the years, and they are just overwhelmed at the moment. I'm regularly by email and WhatsApp and phone calls to them, and they are always busy, but they're especially busy at the moment. They're usually busy with clinical work, and it's difficult to do much work in the community, however much they would like. And I've become, over the years, enormously impressed and encouraged by the work of faith-based organizations. Indeed, the World Health Organization states very clearly that they have a key role to play. Often faith leaders give information that is more trusted to their communities, and they're able to work in communities where some of the government organizations may not be able to work. And there were two particular infections that I had a bit of experience of with Ebola, not a lot. I had to visit Sierra Leone in West Africa a number of times in relation to a Tearfund supported project. But the other area that faith-based organizations have been very active is HIV. And so I've got a bit more experience of working with HIV. So what did we learn from faith-based community groups working with these two infections? Well, the first thing is that sadly, there was a lot of misunderstanding about burial culture in West Africa. There was a tradition of washing the body repeatedly, touching the body, even kissing the body. And when the first lot of health education messages went in, this was not really appreciated, and there were riots. Fortunately, faith-based community groups became extremely effective at behavior change, and this was a really good example of working with faith-based organizations to provide important information widely. The second was HIV. Now, sadly, in the early days of HIV, there was a lot of judgment leading to stigma. Fortunately, over the years, this has now been dispersed because faith leaders have used scriptures and other holy texts from other faiths to support a much more positive, supportive program and approach towards those and have overcome stigma. And indeed, one of the projects that I've been linked with in Kenya over the years has been a fascinating one in which faith-based volunteers do home visits and blood testing using the rapid ELISA test, giving you the result of HIV within 45 seconds, and then rapid referral to treatment. And I have been amazed that these faith-based volunteers have been able to get testing of 80% of the rural households that they visit. Quite an amazing figure. And if you're interested in the interaction between faith-based organizations and HIV, you might like to look up some of the reports. They are available from Tearfund, they're available from USAID. So what did we learn from these faith-based community groups working in Ebola and HIV that is relevant to COVID? The first thing is that it was so important to understand local culture and work at developing relationships. There's no place for just marching in and ordering people about. Secondly, the message has to be not only accurate, but it's got to be clear and it's got to be acceptable. The third thing, and there was a lot of misinformation about HIV out there, and there's a lot of misinformation about COVID out there. There are some disastrous statements by very important people at the present time. But there was also hesitancy. We are familiar with hesitancy in pediatrics, tragically in relation to immunization hesitancy, where there is false information being given so that people do not bring their children for vaccine. But this is more widespread, and COVID is still is actually having a lot of hesitancy, which we'll talk about a bit later. The fourth thing was to be open about money. There was a very interesting project that I had to visit where the money was absolutely clear from beginning to end. And it was known who was a regular project officer getting a salary, how much money people got for attending a training workshop, and if they got any expenses. And it was clear that after the initial training, people were encouraged to continue as volunteers without money. And the experience was that in the project where there was very clear transparency about money, that project continued when the initial stipend stopped, and it's continuing even today. Whereas in the one that resulted in nobody really knowing who was getting paid for what, it stopped very quickly. So honesty, integrity, and transparency. Fifthly, becoming effective and accountable advocates. The role of the faith-based organizations is to be an advocate for people who are vulnerable. And sixthly, really working at good cooperation. The poor health workers are working flat out in the hospitals or in the clinics. The health authorities are very, very busy. And to actually have a group such as a faith-based organization come along and help them, that is so encouraging. So I want to talk about 4 key aspects of faith-based community groups. The first and the second refer to COVID infection, and the third and the fourth refer to lockdown as a result of COVID infection. So let's talk about prevention first. That's number 1. The opportunities for information are enormous. At the top left of this slide is an excellent poster prepared by the Ministry of Health in South Sudan, but it's not widely available because of access, because of printing problem, and the faith-based organizations in South Sudan are actually now taking responsibility for printing this, taking this out to communities and working with them. Similarly, in terms of water, and making sure that people know about the importance of hygiene as well as spacing, testing and tracing, also roles where faith-based organizations can contribute, because it's only if we can absolutely test and trace that we will be able to control this epidemic. Very important for me, certainly, to understand the importance of understanding clear messages by trusted people in local dialects. And this particular project that is very well spoken about in Zambia, where I worked for many years, is actually the best one is by the nuns on the radio. Something that perhaps we don't, as doctors and other healthcare workers, think enough about is the importance of working with children. They are, after all, enormously open to learning. And I've just put up here a website, which some of you may be interested in, called Children for Health. This has got posters, it's got games, it's got learning activities, and this has been tried and tested for many, many years in different countries, both in Africa and Asia and South America. And it's a great opportunity for getting materials if that is what you would like to do for prevention. I'd now like to go to the second aspect of the related activities for faith-based organizations of COVID, and that is care. And that's care for those looking after patients with COVID in hospital, and more commonly for patients with COVID at home. Most patients with COVID are not going to be looked after in hospital because they just do not have enough resources, they do not have enough beds or ventilators, and sadly, the reality is that most people will be at home. This is just an example of one wonderful nurse who basically made the decision to isolate herself from her children because she was working on a COVID ward, and at that time, personal protective equipment was not adequately available. And so this wonderful woman worked for 9 weeks, never seeing her children except by talking with them on a phone. Now, how did she survive? She survived because there was practical family support from a local church and from her family. What we're discovering is that the emotional strain of looking after patients with COVID is horrific. It's very tough looking after these seriously ill people who have a high mortality rate. And nurses and other healthcare workers and doctors are getting enormous drain of their emotions. And having people who speak with them on the phone or over the wall to support them emotionally has been crucial. And there's a great opportunity for people to assist with prayer. And that has been enormously valuable. As I said, many hospitals are already overwhelmed, and so most patients are being looked after at home. And this is where we need care for carers who are looking after patients with COVID at home. They need the same sort of thing, the people who are looking after patients, feeding them, giving them care for their washing, and especially when they're too weak. They need the same things, practical family support. I'm going to tell you a bit of a personal story. I hope you don't mind. I know a young man, he's English, he is a teacher in South America. He was recently moved to a new town to be a teacher, and he lives in a single flat. He hardly made any friends before lockdown. He caught COVID and was seriously ill with pneumonia. Fortunately, his oxygen saturations were not too bad, so he was not admitted, which is just as well because they didn't have any ventilators spare. And he was at home, breathless, too breathless to eat, let alone cook or go out to buy. And there were some wonderful Christian ladies who prepared food for him and brought it outside his room every day. And that was a very practical thing that a faith-based organization did, together with the emotional support and prayer. And sadly, people are going to die. They're already dying. And there is a real place for the faith-based organizations coming alongside the families of those who've died, giving compassion. And compassion actually can only really come from inside. And compassion really deeply can come from God and give compassion when compassion dries up. It's tough looking after many people who have died or being alongside them, but that is something that the faith-based organizations do. Safe funerals, alternative goodbyes. And there's a website here that might help as one has to face some new ways of saying goodbye. The third activity for faith-based organizations is coming on to the harmful effect of lockdown. Now, I'm going to show you some data from India, which has just been published in The Lancet, which shows that between March 2019, pre-COVID, and March 2020, where we are at the moment, there have been a horrific reduction in attendance at clinics. Immunizations are down by 69%, institutional deliveries by 21%, clinic attendance for cardiac events down by 50%, and even inpatient care for TB by 32%. From my experience of working over the years and more recently in Zambia, and I'm in regular contact with my colleagues there, what we're seeing is this, that fewer women are coming to antenatal services. Fewer women are delivering in professional delivery facilities. Many fewer children are coming for immunization. Mums coming for family planning. Vitamin A distribution is seriously hampered. Numbers of patients going to the TB and HIV clinics for their treatment is down, and cardiac and cancer clinics are down. So these people need to attend these regular clinics for their healthcare. We do not know yet, but we do know that already we are seeing obstetric and pediatric complications, not specifically from the virus, but from the lockdown. So what are faith-based community groups doing? Well, I just wanted to share some specific examples with you of what patients are being helped by faith-based organizations. The first is a great one. There's a place in Zambia where the local faith-based organization has actually built an extension to the outpatient area so that people can safely spaced, have the rain kept off them, and they can attend regularly. And it's been the faith-based organization that's built it. Secondly, sometimes there's a group who's actually reminding patients. I think we're all forgetful about things sometimes, and having somebody to remind, yeah, You've got to go tomorrow. There's a new program whereby faith-based organizations is arranging to collect medicines for TB and HIV, and thereby avoiding the drug resistance that will develop if people do not take their medicines properly. And another interesting activity by a faith-based group has been birthing compounds. One of the problems we're facing in Africa at the moment is that because of lockdown and transport problems, women are coming late in their delivery, sometimes with obstructed labor, sometimes with a retained placenta that needs to come out, sometimes with toxemia that's not being treated properly. And to have a birthing compound so that people can actually stay there for quite a number of days before their due date has been really quite life-saving. And the next thing, as I mentioned before, collaboration with healthcare workers. The next thing is identification and obtaining support for those whose livelihoods are damaged by lockdown. Now, lockdown is affecting very vulnerable groups. Nothing very surprising about this list, but it's always worth thinking about who is very vulnerable in any community affected by COVID. 1, those with minimal wages or unemployed. 2, those with disability. They've always faced challenges, but especially with lockdown. Those where there is family conflict, where violence against women, against children, between adults, whatever. Those people might have been supported, but are not now. Those with chronic disease, including mental illness, and those without voice in society. For my own program of work, we are focusing mainly on maternal HIV, prevention of mother-to-child transmission of HIV, and as part of that, we have an income-generating activity for particularly for women. This photo on the left just shows some of them, great but very poor ladies who were benefiting enormously from the skill training had stopped. Their income has dropped overnight. On the right, a rather horrific picture that shows thousands of young men queuing for food in South Africa because of job loss leading to malnutrition. But what can faith-based groups do? They can identify, they can report, they can obtain support. And I just want to give some specific examples where this is happening. I think the first thing perhaps to recognize is that local knowledge is incredibly important. There's no magic bullet for dealing with lockdown damaged people. Local knowledge is crucial. And people need to develop their own analysis of problems and root cause. They need to be encouraged and enabled to develop local initiative and innovation. And then somebody needs to be an advocate to government or NGO or faith organizations. We live in a very competitive world. And in the world of COVID, there is an opportunity from time to time for getting hold of funds for particularly disadvantaged and damaged groups. And there are no shortcuts. It is only those projects that are well written, well described, clear targets, clear accountability, clear reporting that will get funded. And that is something that some of the faith-based groups are doing in a number of African countries that I'm working with. Just a few summary slides before we finish. Local innovation, absolutely crucial. As usual, mostly the women who know what is going on in a local community. Secondly, keep in contact. One group is basically left some mobiles with particularly vulnerable families that have got a pregnancy about to deliver, because those vulnerable families would not be able to get to a clinic where there's a midwife. And so they're able to use those phones to call somebody who will offer to transport them. Contact. Thirdly, caring friendship. This doesn't come out of bottles. It cannot be injected. Caring friendship is something that faith-based organizations produce, which can be quite life-saving. And obviously food security, whether it's seeking to encourage growth of food in a more sustainable manner or earning enough income to purchase food. Those are all important things. And just a couple more to finish with. There is an enormous role for faith groups to be advocates for the poorest. And this is a great example whereby a faith group put together a very clear action plan to an NGO working with government to provide a water supply for a whole area of the community where there was a very high proportion of vulnerable people. That did not depend on just having vulnerable people. It did not just depend on having an NGO in the capital city with some resources. It needed that link, and that faith group was the link between the vulnerable and the resourced. Even something simple, one might think, like soap. I'm in regular contact with some of our colleagues in South Sudan at the moment, and the horrific problem with the lockdown over borders is that the price and the availability of soap is drastically reduced. And so the role of one of the faith-based organizations is to actually seek to get soap at a reasonable price. And then the final thing, just an application form, is showing how important it is that the faith-based organizations can be articulate advocates. And there may be some training here. Not all faith-based organizations necessarily have the skills in funding, application, writing. They don't have any of the skills in monitoring and reporting. But from my experience, that's the sort of thing that will attract support for those in vulnerable situations and in lockdown. I've got two organizations that have got great range of activities and materials that you might be interested in. First, as Peter mentioned, I've been fortunate to be associated with Tearfund, which works with a number of faith-based organizations in countries all over the world. They have a great series of learning resources with a particular focus on action, and the website is there. They've got a new one on COVID-19 at the present time. So if you're interested in seeing how community-based activities can be supported, you could get some really helpful ideas from some of their experience there. And the second one is a small but very important organization called the Arouca Network. Its focus is specifically on getting communities to work together to understand how they can look at their own problems, how they can, in a sustainable way, develop programs of activity that make a difference. And they too have some really excellent examples of community-based care on their website. Final slide. I think we could just summarize the 4 key points that I hope this webinar has been able to present. Firstly, prevention. Governments on their own are not going to be able to do this. It needs community engagement, community action, and it's going to need the support of faith-based organizations who are absolutely central to that. Secondly, care for those who are looking after patients in hospital. Care for the nurses, care for the other healthcare staff who are really working so hard, working so professionally and working so compassionately. Many of them getting burnout and they need support. Secondly, for the families who are looking after patients at home. That's the majority of the situations. How do they cope? How do they prevent spread of COVID within the extended family, where you've got lots of people often living together in the same accommodation? All sorts of ways in which faith-based organizations can contribute. And lastly, those who die. There is a new way of saying goodbye to people who die because of COVID. And it needs some very thoughtful and compassionate and prayerful consideration of how to do that with dignity. Then thirdly, we're talking about those who are needing to attend regularly and they're not able to because of lockdown. And there may be specific, indeed there are specific instances of ways in which community groups can make a difference. They can support the particularly vulnerable. They can do it within their own resources. And then finally, sometimes it's appropriate to engage with outside resources. There are, even in this dreadful economic stress that so many countries are under, there are funding bodies around. And basically, the smart faith-based organizations are going to be the ones who produce good projects, good documents, and good accountability. So those are the four that I see some great examples and some great encouragement of things that are already happening. I hope that some of these may be of interest to you. I want to thank you enormously for listening, and I'm always very, very glad to learn from people's experiences. So comments and questions, please. Thank you very much. I'm going to hand over to Peter.
Thank you very much, Andrew. Incredibly clear, incredibly comprehensive, and the watchword all the way through was about compassion. Faith-based organizations and groups standing between the vulnerable and those who can provide resources. So please get those questions coming in now to Andrew. And Andrew, if I could come to you with the first question, which is coming from a UK context here. And they're saying, due to the recent change in the UK government policy, and I'll just explain this briefly, the DFID, or the Department for International Development, has been brought into the Foreign Office in the UK. Will this increase or decrease the likelihood of UK and overseas faith-based organisations receiving funding to help meeting the challenges of COVID-19 in Africa and elsewhere? And perhaps a follow-up question to that would be, what could we do about it, or how can we best deal with the situation?
Well, that's a really helpful and important piece of information. It was announced yesterday, only yesterday, as right up to date news, that the Department for International Development, which used to be an autonomous department, is now going to be part of the Foreign and Commonwealth Office. There are all sorts of reasons that were given for the benefits of that. But let me say two things. First is that over the years, DFID has had no problems in funding faith-based organizations in many developing countries. And some of the projects that I've been talking about have actually been funded by the Department of International Development UK. The second thing I would say, and it may be just because I'm an academic, basically, and that is that the projects that DFID or any other organization that has got funding, such as the European Union, the Japanese government, the Chinese government, massive amount of money available now in Africa from China, are all going to be looking very carefully and very critically at the applications that they receive. And if there's one message I would hope that comes over from this webinar. That is that in country, they've all got offices. And basically, rather than have a small group of healthcare workers and a small group of faith-based or workers going with a project, if you can do a joined up project involving a number of community care programs, involving healthcare programs, and work together and develop a really carefully thought through proposal, I know that even in the tough times of COVID, it's going to be possible. So some people are very worried about the link between DFID and FCO. I think at the moment it's something that we don't know what the outcome is going to be, but one thing I'm quite clear that it is 100% worthwhile still going to those organisations to help with community care of HIV.
Thank you very much, Andrew. Next question from someone you'll know, I think. Howard Lyons is asking this question.
Yes.
Are you aware of Christian organisations gearing up their financial and other resources to help faith-based organisations, particularly mission hospitals and community projects, to cope with lockdown and coronavirus?
It's tough. It's tough. I'm a bit involved with one of the dioceses in the Church of England in Salisbury, in the west part of England, and it's interesting that the emphasis of support from Salisbury is going to be for a WASH program, which is faith-based. For those of you who don't understand what WASH is, it's water, advocacy, sanitation, and hygiene. It's an enormously important program for improving water supplies, improving hygiene, which relate to improved outcome of disease. Not only does it prevent diarrheal disease and respiratory infection and intestinal worms, we've known that for donkey's years, but it's interesting that that is what the Salisbury Diocese has done, to focus on the church's role in public health. So that's one organisation where a funding body is definitely focusing on specific activities. I also know that Tearfund is working some new activities. To be quite honest, I'm not aware of the details, but I think it's often a fine balance between getting a really good pull and really good push at the same time. And it can't be Tearfund or Salisbury Diocese pushing, it has to be a pull for what is really needed, what is necessarily going to work on the ground. I hope that helps Howard a bit. I know that Howard has got lots of experience in this and insight.
Thank you. Perhaps another name you might recognise from Ted Lancaster this time, Andrew. You've got some great fans on the line.
Oh dear.
Ted is saying, and Ted of course is the director of the Arouca Network, which you've mentioned already, and he's saying, could you say more about the ways that faith-based organisations could have a greater influence at higher levels? So perhaps in advocacy, helping to shape policy, and maybe some examples of best practice as well.
Yeah, I've had the privilege of working with a number of organisations such as the Christian Health Associations of Kenya, Malawi, Zambia, Nigeria. I'm sorry if I've forgotten a few others. And what has been really impressive over the years is that when those organisations, which are all indigenous national organisations, really work together, they are very able to get funding. And I think it comes back to the point is that you've got the best way of doing it is not just a small group doing it on their own, but to actually develop consortia of organizations that have got the same vision, the same opportunities of working together and giving accountable feedback to donors. And that is going to be increasingly important, in my view, in the future, with reducing funds because of the horrific global nature of this terrible virus, we're going to see a lot of competition for funds. And I suspect the faith-based organizations, the community organizations, which have effective consortia are going to be the ones that are going to have the greatest effect, rather than just relying on small ones on the ground.
Our next question from Hanning Nalato is asking, what roles can faith-based organizations play in getting governments to be accountable to their own citizens, particularly in settings where the government has been insensitive or unaware of what the needs are, so that advocating on behalf of the vulnerable?
I've got personal experience of doing this in Kenya, where as part of the ongoing monitoring, the community surveys involved recording information on the frequency with which services were provided and the frequency with which staff were available. Oftentimes you might have a service such as an immunization. What was really very interesting. It was that as a result of the surveys of the proportion of people who were able to access a clinic, the proportion of people who were given appropriate immunizations when they were there, that was presented to the local health authority. It was due to the district health officer. And that actually then led to a greater allocation of resources to those people who were not receiving good care. I think there's two ways of trying to change policy. One is to be incredibly vocal, and there are lots of very effective pressure movements, and that's great. I suspect the people who are able to be effective just by speaking passionately to a district health officer are probably few. If, however, such a passion and care is associated with data showing the very low percentage of provision of clinics, that, I believe, is a good way of improving care. And certainly that resulted in much improved care in Kenya.
Another problem that's been raised here, sometimes faith-based organizations are not particularly interested in advocacy work or speaking out, or perhaps they might not even see it as part of their Christian witness, that they think it's much more important to be the hands of compassion than actually speaking to others. So I'm sure you've struck this sort of situation before, where people are much more focused on care to the exclusion of being a voice. Could you give us any advice about how to mobilize faith-based groups or encourage them to be more of a voice when that's required, either, as you say, in a campaigning way or in a quiet way with data and so on?
Well, I've been very, very privileged in my career. I have been able to meet and have lovely friendships with some faith-based leaders in a number of African countries. And what I've found is the first thing that has relevance to the question is how important they take the biblical verses on equity and justice. There's a lot of verses on love and care and compassion, and they're often quoted and acted on. But if one also looks at the biblical verses on equity and justice and looks at the unjust ways in which people live in certain parts of the world, including the country in which I'm speaking at the moment, we have massive problems of inequity and injustice. But perhaps for a faith-based organization, that has to start with a faith approach to what is the meaning of life on earth in terms of service. And for me, the one thing that I saw worked for faith leaders was to start with the sacred scriptures and to encourage them to see examples of how important equity is in the Old Testament and in the New Testament, and then see practical ways of which that can work. There's nothing that can impress people more than taking them to somewhere that is really suffering and showing them how it has improved. So it isn't just a case of theoretical sitting in a conference room, sitting around a circle, holding a Bible open. It's absolutely essential that the faith leaders get out and see the situations, to see the wonderful things that can occur when such key verses, key themes of importance to God are put into practice, of equity and injustice.
Thank you. What we're seeing around the world, this is from Mwai Makoka from the World Council of Churches, who's saying many of the adverse effects of COVID are due to copy and paste approaches of lockdown measures where countries have just copied each other, where their national situations and challenges might be very, very different. How can faith-based organizations influence governments in such cases to get them to adjust their policy and make it more nationally appropriate?
That is such a perceptive question and an observation. Thank you so much. I mean, I wish I'd had a chance to do more. I probably tried to put too much in the 30 minutes. I could not agree more. The idea of a one-size-fits-all nations is just completely inappropriate. I do not have very strong data to back up what I'm about to say, but my deep, deep concern is that the number of people who are in severe disease states or possibly even dying from the results of lockdown may well exceed those who are dying from COVID in quite a number of countries. And it has to be an evidence-based approach to these are harsh numbers. It's the numbers of people with disease, the numbers of people who die, against some of the other data, like maternal health mortality. We're already seeing some data coming out that maternal mortality is going up and child mortality is going up. And we know what's going to happen. Let's face it, these women are coming in such late stage labor with obstructed labor. They have problems of severe bleeding. They have problems of retained placenta. The children are not getting vaccinated. We're already seeing massive outbreaks of measles in many countries now as a result of poor immunization. So every country, I would say, the role of the faith-based organization is to try and collate these key aspects of information and highlight situation in a clear, critically put together document, so that people don't just copy from one country to another. Because in a nutshell, my concern, as you've probably picked up from this presentation, is that the damage from COVID is going to be through lockdown in some countries rather than the virus causing death.
Thank you, Andrew. Sometimes faith-based organizations can be more of a problem than a help. And this next question relates to this. It can be very difficult to work with faith-based organizations that are either promoting hesitancy or unhelpful practices, such as a faith leader rejecting vaccination programs, for example. Could you share your experience of perhaps some principles on how to work with other faith-based organizations that are not acting helpfully in the situation? I'm sure you will have observed this.
Yeah, this is a real challenge, and thank you so much for that really perceptive question. I would say the first thing is that one needs to be able to be very, very clear about the integrity of any statement by anybody. And just because one particular political leader believes in a certain type of fruit juice, or a certain type of bleach, or a certain type of anti-malarial, it does not mean to say that this is backed up by evidence. And so I see the role of the faith-based organizations of promoting integrity and scientific evidence. And that may be tough for the faith-based organizations because they haven't got necessarily people in their organizations who are used to this very critical thinking level of planning. But if you go into any of the health services in all the countries, resource poor countries, you will find women and men of deep, deep faith, and they will be able to join. So I would say that actually the faith-based organizations could be a little bit more on promoting evidence-based practice for my country or my district. And that would be a document which would be pulled together, which would emphasize the positive and would then take apart, literally take apart some of the rubbish that is talked about by some of the politically important people. And, you know, we don't do these sort of things on our own. We are inspired by the creator of the universe. And it's a tough line sometimes to have to disagree with senior people. Let me give you an example. We've got a situation in Britain where there's a lot of people, for all sorts of reasons, want to keep children at home and not go to school. And when you look at the data on the number of children who are going to get sick, and the number of children are going to transmit it, and the number of children who are going to have a problem as a result of going back to school, it's minimal compared with the devastating impact of socially, intellectually, developmentally of not going to school. And so a number of us, you might have even seen it in the British papers, have actually really streaking very, very strongly about the importance of getting children back to school. Now that's an evidence-based approach. It's not an opinion-based. So I would say the faith-based groups have enormous opportunity for getting evidence-based good healthcare.
Thank you very much, Andrew. I'm afraid we've run out of time and the questions are still flowing. And thank you so much for not just your talk, but for answering the questions so capably. I think you probably have won the prize for being able to hold an audience, in the sense that the numbers listening have not dropped at all during the question time. So I think that's a testimony to how much you've engaged them. Let me just say thanks again to all of you for joining us, and we hope to see you again soon on ICMDA webinars. God bless you. Thank you.